Hi, my name is Piper Wild, and I am doing a book club presentation on the book Bodies and Barriers, Queer Activists on Health. Overall, this book emphasizes the need for increased awareness and advocacy to improve the health and well-being of transgender individuals, particularly those who face multiple forms of oppression and marginalization. Some of the barriers that this group face are accessing healthcare, discrimination, lack of knowledge and training among providers, economic barriers, systemic oppression and discrimination, and access to gender-affirming healthcare. Some health disparities among transgender individuals are a high risk for mental health issues, including depression, anxiety, and suicidal ideations. Barriers to accessing healthcare, including discrimination, lack of knowledge among providers, and economic barriers. There are higher rates of violence, including hate crimes, sexual assault, and intimate partner violence as well. There's also a higher risk of HIV and other STIs. Transgender individuals are also more likely to have substance use and abuse problems. Addressing these health disparities requires a systemic changes that promote inclusion, acceptance, and access to healthcare for transgender individuals. This includes increasing awareness and education among healthcare providers, providing gender-affirming healthcare, and addressing root causes of discrimination and violence against transgender individuals. As a psychiatric RN, health promotion would look like providing gender-affirming care, screening for mental health issues, providing education and support, promoting sexual health, addressing substance use and abuse, and addressing violence. A new nurse could use this book for a resource to increase awareness of health disparities, improve cultural competence, enhance patient care, and promote advocacy, promote diversity and inclusion in healthcare. A veteran nurse could use this book as a resource by incorporating it into continuing education programs. Veteran nurses can stay up to date on best practices in providing care for LGBTQ individuals and contribute to a more inclusive and welcoming healthcare environment. When identifying something that surprised me in the book, thinking back, I found myself surprised that the stigma of having HIV has worsened over the years, despite the advances in science and medicine. People can live long, healthy, full lives with HIV now. And so I was surprised to find that people were even more stigmatized by that. And I have had to look up this word many times in my career. As a psych nurse, we deal with many transgender individuals, and I don't know why I can't keep this word in my head. But the word cisgender is a person who identifies with their registered birth sex. So that's a word that I did have to look up once again while reading this book. One of the pieces of information that stayed with me the most was the statistics show that transgender people are twice as likely to be veterans than the mainstream population. When reading the book, I felt internally confused because I do personally identify with the LGBTQ community. And when reading the book, I felt like some of the people in the stories were complaining a lot. I didn't want to feel that way. And so the fact that I did, it felt I was left sort of confused on the inside. Some lingering questions that I still think about are I just wonder, why are transgender people more likely to be veterans than the mainstream population? I would actually have assumed it would have been the opposite. Is it because they strive to fit in? Is it because it provides access to health care? Um, I just I just wonder what makes that true. Here's my reference, and thank you for listening.